Chinese here. Do you know the Chinese, what they say in here? Some of you have learned the Chinese, right? Some the alumni. Yeah. The window. What do they say in the window? Jiao. No. They say, I don't want to die. I don't want to wait to die. Yeah. They say, patient and the cases and the just healthy people need to separate. They say patient need to separate, and this is the newspaper. It's just around the SARS pandemic. They say lots of negative information. It said I can translate. There are 2 physicians fever because SARS. The nurses straight in the stressful condition, they can adorable this situation, and avoidable. Sorry, it's avoidable, and they are very just shocked turn in here. It said other than fear, no other word, only fear, no other word. Yeah, so lots of the just negative words, yeah, panic, stressful, anxiety. Okay, so we learned this why, so we know we needed to do the early prevention. So this is the first we learn. So what we learned, what we done for early prevention, because you know the Ncku is the first university in Taiwan to announce the delayed school open. You know, we are first one, delayed 2 weeks to open school. Yeah. And also we are the first school to unlock campus, the middle of June. So this is a week, what the competence we have. We have the just to predict competence. So you need to learn the predictive competence. Okay. The picture is the day we have lecture and we are happy. Just it's not necessary to wear a mask. And otherwise, the school, they have preparation, lots of activity to against the just COVID-19 pandemic, including we set up the website. The website put all the informations, everyone can access it. Then we create the QR code. It means easily to access all informations. And so the update health update information and also self-care strategies. And also we have a self-care guideline post on the website, so everyone can get it. The second one, the achievement is the multiple discipline research and development activity. This is the the achievement is led by the Professor Zhang Longxin. He is the director of information department in our Ncku hospital. He used the AI technique to create a meta check system to detect high-risk patients with pneumonia. Okay. And second one, of course, is our director, Dr. Go. She lead a team to create our dean said the device, wearable device to detect the body temperature continually, and also the team also just published the result in the journal. Then I will talk about the power of creativity and the sharing. Have you been to here? Korea, yeah? Do you step in the house? No, not yet. Yeah, it's just creativity, transdisciplinary creativity to build up the emergency medical just shelter, just portable. Okay. So we said the QE. I thought that the president should have an introduction. So I want to invite you to watch this video. How can? Yeah. Could you help me because? Yeah, this one. Yeah.
choose the 老师可以选绿色下面那个稍后再说。
在哪？你跟我在哪？对，你来了。哦。You have to reshare to sound. Share.
病房是脏的吗？
它是
这是干净的。
它是病分离跟脏的哈，越安定越好。
因为这是一个负压定隔离病房部分，那就是说要经过这个考试手续递送，比如说用餐或吃药物的部分，
不用再进，不
用再进去。
以病房里面来讲，病房是脏的吗？
它是
这是干净的。
它是病分离跟脏的哈，越安定越好。
这个超这个有分上分的概念出来。
我们有做自然采光，所以这是一个绿色的一个防疫医院。排气是负压式，排气
是户外的气风管，这是排气风管。
然后我们的那个负压空气是从这边出的，所以我们医护人员站在这边都不会影响，就是它这样，然后从。在这边只大想带给大家的，就是希望把医疗跟科技还有设计这三个一体结合起来。这个东西都在这个工厂组装好了，然后换到这边做现场组装，用最少的人力。希望它是完全模型化，希望它很快，希望它是循环的，希望它是一个可以来来去去的。
很骄傲的可以宣示，我们是全世界第一个在科学的基础之上，能够实在实做的全方位的及时的医疗场域。最后，在全世界历史的转动里边，也有了一个经典的出发。这个时候呢，成大存在，台南存在，台湾存在，而世界会有更好的未来。
我们今天准备好，把这些科技防疫的根深深的扎在大学里面，以后我们面向每一个危机，这些经验都会复制，而且转身就会把这种东西跟大家分享。不管如何，在每一个节点上都有可能向上，也可能向下。我们必须做好向下的期待，但是要做好向上的准备。
Okay. I thought the beauty is not just show our the creativity. We also want to show our the sharing of love. Because actually the structure or the design, the draft is open sources for everyone. So if you like it, they have website, you can download the open sources. Okay. And the second one, the creation is about a mask. Before the COVID-19, we never know the mask is a fashion kit, right? Fashion goods, because with a mask is a mask. But the faculty in the Ncku, he create the fashion style of mask. Yeah, colorful. Yeah. Also, the design, you have hub or design the hub. The just one staff create the buffer pressure, of the mask, because the health workers, if we just put on the mask always every day, will cause wear pressure your ears. So he create this device, use the 3D printer to create it, and is also provided the open sources document to everyone. So one of the hospital from the Singapore asked the open sources. Yeah, so I mean it's sharing experience, sharing value with them. Otherwise, I'm very proud of our nursing students, including domestic and international students, because you help our hospital to translate a COVID-19 diagnosis into English, Indonesia, and Vietnamese versions. Okay, so you are so excellent. Okay. And all of the achievement is about the, setting the health self-management system. See in the campus have the several prevention the settings for against COVID-19, including the body temperature monitoring, we ask everyone wearing the face mask in the public areas and get the control in campus, and suspend the large-scale activity and the conference and keep social distance, and so emphasize on hand hygiene behavior. And also we encourage everyone do the health promotion activity. And have everyone this one to take this one is a self monitor for your not only the blood pressure, also the body temperature. So we have we set up this device in the department of nursing, and we have the footprint records in campus and also each building in the campus. And we provide the just bilingual the health education material to everyone who live in Taiwan. Also, I think most important, we don't want the student, because this event just drop the study or stop their learning. Okay. So when we know that this event, the Dr. Cole just host a contingency, the planning meeting for responding to COVID-19. At this meeting, we discussed what kind of teaching models we have to do at the late moment. And we also discussed the clinical practicum, and we asked everyone keep a social distance and request a cross-sitting pattern, also provide the emotional support to students and faculties. And we said we need to use the technology-based learning and the meeting. And we also established statement for COVID-19. Okay. And here is the clinical practical course, what the students have to do and the faculty need to do to pay attention. Is we teach the students and faculty educate how the virus spreads, and also practice the hygiene, emphasize the skill of infection control, temperature daily, and alert the symptom of COVID-19, wear mask in hospital and public area. For the student and faculty in the clinical practicum course, we provide the mask in free, everyday one mask. And we also excellent practice wearing the isolation gown and support each other, because at the late moment it's very stressful for the nurse, the student and faculty when they have the clinical practicum course. And here our department, the APEN Association also held a COVID-19 pandemic just the meeting. The meeting we will share we asked the member committee to share the COVID-19, the experience against the experiences. Also, we just announced the role of APEN position statement. And we will reschedule the fourth Asian conference in Hanoi. Also, we will just our department and the association, Taiwan Association of Nursing Education, we held 2 online conferences to support the faculty and all the nursing educations, the online teaching skills. And we also conduct a survey regarding clinical practicum teachings. Actually, based on the survey, we find that only around the 10% of schools, their clinical course was affected by the COVID-19. And we support all the faculty and students about online teaching. And this is, I'm very glad that our school already had a Moodle support the online teaching very much. Finally, I think is the what we will do in the future based on the COVID-19. We think in the future we will create the international online nursing master program. So you can, if someone they can just stop by the Taiwan, you can just attend this online program. Otherwise, we create a classroom 10 for e-learning era. Okay, for the long distance learning, and we will just create the VR and AR learning. As you know, we already have a VR AR the classroom. Finally, is the I thought I would like to ask my advice, Mimi, also the president of ANI, to read this one is the summary. If you know, you can read it. Okay, Mimi, please.
Okay, for the conclusion of this page is, it was the best of times. It was the worst of times. It was the age of wisdom. It was the age of foolishness. It was the epoch of belief. It was the epoch of incredulity. It was the season of light. It was the season of darkness. It was the spring of hope. It was the winter of despair. We had everything before us. We had nothing before us. We were all going direct to heaven. We were all going to going direct of other way. Charles Dickens.
Yeah, it's Charles Dickens. He wrote is in the A Tale of Fiction or A Tale of Two Cities. I would like to use this to be the conclusion, and I just want to you think which side you want to for. Stand the best side, the worst side, wisdom or foolishness. Okay, thank you everyone.
Thank you very much, Professor Xu. It's exactly 20 minutes. So, and then it was very wonderful, a short presentation, enlightening and highlighting the global achievement of NCKU, especially in the nursing department. So once again, congratulations. And now we have 3 questions. I will just ask one by one, Professor Xu. The first one is from Mega Sylvia. How does this pandemic affect nurses' performance?
Nursing performance.
Yes.
Yeah. Okay. I think the nursing performance is the we know is very I need to say really for the nurses and all the healthcare providers, they are in the very stressful the situation, and but we need to let to know what is we need to provide the knowledge of COVID-19 and provide the protective the kids. Yeah. And actually not because we have the experience of COVID, the SARS, so it's unlike the 2003, the nurses they know how to take care of the patient with the COVID-19 or suspected the COVID-19 patients. And also I think it's very all the people that in here, you know, we write, include me, lots of people that write the cards to our healthcare providers. So I think the nurses, they are very proud of. They are the nurses at this moment.
Thank you very much, Professor Xu. And now there are 2 questions, but heading to one direction. So I'll just say it at once. From Septa in Taiwan and from Swab in Balikpapan, Indonesia. So I just read the question. We know that Taiwan has very low cases of COVID-19 and NCKU has been awarded as the most impactful university. What is the most useful strategy to reduce the spread of COVID-19, especially in university setting? And what is the prevention to prevent the spread of COVID-19 further?
Okay, thank you. I think we the prevention is we act very strictly to get control in hospital, and also we limit the visitor just for the patients. And everyone, just only the healthcare provider and the related officers, they can enter the hospital. Yeah, and we have very strictly we emphasize the just the hand hygiene and the infection control, and every day we need to have the just monitor the temperature twice at least, morning and evening. And also I thought I can supply the, you said the nurses the performance, because we have the stipend for the nurses if they care the patient with COVID-19 or suspended. Yeah.
So thank you. And I think I have one question for you, Professor Su, because you mentioned earlier that a lot of creativity has been created in NCKU. And what is the message for us, especially countries that are still facing working from home with a lot of social distancing, how to maintain our creativity in during this pandemic?
Could you repeat? You mean the maintain the
Creativity.
activity?
Creative, innovative, how to be still creative and innovative during this pandemic.
How to resolve the pandemic with creative or efficient.
Integrated.
Yes.
Yeah. Okay. Got it. Also, the integrated resources. Actually, the resources is from all the central, the command centers. Yeah. Every day they will say that how that we have to report how many the storage we have, the protection gown, mask. Yeah. So it is the integrated, and also we have to report the command center, the how many patients, and every the hospital we have set up the fever screening the stand.
Okay, I see. So this is one more question. I think this will be last question, Professor Shu. This is from Surakarta. How the COVID-19 impact student admission in NCKU? Is there any decrease or what?
Okay. I think this year we not yet heard the student. They don't want to enroll, just enter the nursing department. Yeah. But I know it's very severe impact in the 2003 SARS event. But at this moment, no decrease, other side increase, because they think to be a healthcare provider professional is very big powder, because the society, we respect the health professional, they care us. Yeah.
Oh, thank you very much. Yeah. That is very wonderful news to hear. So because we are very limited in time, so once again, thank you very much, Professor Shu. I think from Professor Shu's presentation that we heard a lot about the achievement that has been done by NCKU and some hopes for the future of nursing worldwide. So before we close this webinar session, especially your keynote speech, would you please to give us a closing statement, Professor Shu?
Thank you. Because I think this is hope era. Okay, and also creative era and the sharing era. Thank you.
So hope, creative, and sharing. So thank you for the message, Professor Su. And for the all audience, we have heard a lot during this very short minute of Professor Su keynote speech. And thank you very much for very valuable information that you share for all of us around the world. So once again, thank you very much, Professor Su, for your time and experience. And now I would like to return this time to our master ceremony. Ibu Ririn, time back for you. Thank you very much.
Thank you, Dr. Putu.
Okay, thank you very much for Bapak Putu Dharma Suyasa, PhD, and also Professor Suyuyun, Creative and Sharing Era. I really agree with that. Okay, thank you very much for this very interactive discussion. And now I would like to invite Professor Suyuyun to receive certificate as the keynote speaker in our conference that given by President of AINA, Mrs. Sumarni MS. Maybe in 109 room, Mrs. Sumarni can give a certificate for Professor Suyuyun. And for Bapak Putu, Pak Putu, we will send to Bali. Yeah, we hope we can meet each other and we can give certificate directly.
Thank you.
But maybe it's only from screen. Thank you very much, Pak Putu, for contribution in this conference.
Thank you very much and congratulations to all of you.
Yeah, see you next time, Pak Putu.
Thank you.
Thank you, Pak Putu.
Thank you.
Okay, and now we are going to the next section, which is panel session by Ncku alumni that will be moderated by Bapak, maybe not Bapak. It's quite difficult to mention Bapak for Azam, maybe just Saudara saja ya. Saudara Azam David Saifullah MS. I think he is not only Master of Science, but also Master of Public Speaking, because I learned very much about public speaking with him, and you will see that. And now he is a PhD student in Queen's University, Belfast, UK. And for bachelor degree, he got bachelor degree in School of Nursing, Medical Faculty, Diponegoro University. And for a master degree, he's graduated from National Ncku University, of course, as alumni. Then he is also very active in organization, especially Association of Mental Health Nurses of Indonesia in Yogyakarta, and also volunteer of Alzheimer Indonesia, Yogyakarta. And now he works in Department of Community and Mental Health Nursing, Faculty of Medicine, Universitas Gadjah Mada, as a lecturer with so many seminar, conference, training, symposium experience, and also he is very active and productive in research, community service, and publication that concern about schizophrenia, patient, and also elderly. And with the achievement, especially in English debate contest and also public speaking. Well, ladies and gentlemen, please welcome our moderator panel section, Saudara Azam David Saifullah, MS. Time is yours, Azam.
Yeah, thank you very much, Ririn, for the introduction. That is so fabulous. And good morning, everyone. Good afternoon, good evening from wherever you are. Welcome to the panel discussion of the webinar. I am Azam Saifullah, or maybe people in Taiwan know me as David. That is my middle name, and that is my name. And I do feel honored to be the moderator for this session. And this session will be divided into the panel session. So the panelists will deliver their topic for about 20 minutes each, and then will be continued to the question and answer session. And for all the attendees, you are very free to ask any question related to the topic. The topic will be related to education and then research, and also how to deliver social community services during this pandemic of COVID-19. And if you have any question related to that, please type your question on the Q&A box in the below of your screen, so that we will have your question to be discussed in the question and answer session. You may ask in Indonesian language, so don't worry. Our team will be ready to translate that into English. So don't worry about it. And related to the topic, we'll have a polling related to the next topic. So please kindly check the link on the Q&A or on the chat box. So if there is a link for the polling, please sign in and then answer the question that given in their polling based on your situation. So we will discuss that on the third panelist actually. And I will send the link at there. And I'm very happy today to be here because again, we can see our supervisors there in 109 room there. Thank you very much for attending this. And we are also very happy and proud to have the alumni of International Program of Nursing from NCKU today as the panelists. First, I would like to introduce the first panelist. The first panelist is Mrs. Haryani, BSN MSc PhD. She is currently the head of School of Nursing, Universitas Gadjah Mada, Indonesia. She got her bachelor in nursing from Universitas Indonesia and master from Universitas Gadjah Mada, while the PhD she got from nursing from NCKU. So her study and also research related to the oncology nursing. So if you want to talk about and discuss about oncology nursing, please let her know. Also evidence-based practice in nursing and nursing education. And at least she already published 15 articles in respected journals. And she also a respected member in Indonesian Oncology Nursing Association. And we are very happy to have her here. And without any further ado, please welcome Mrs. Haryani.
Okay, yeah.
Please.
Thank you, Azam. Okay. Okay, good afternoon. Okay, good afternoon, everyone. And thank you for Azam for the time. And thank you for Professor Su as president of NCKU. Sorry, president NCKU, and Professor Ko as director of Department of Nursing NCKU, and Prof. San as a dean of College of Medicine NCKU. It is my honor become one of speaker in this event. Also, thank you for the great advisor, Professor Su. I really miss you all. When I see 109 room, I really want to jump to Taiwan. Also, thank you for the participant that who joined in this webinar. In this event, I will talk about transitioning to the new normal in nursing education. Particularly, I will share what School of Nursing prepare, and perhaps in the Q&A session, we can share each other, because I believe that every institution has strength. I try to share my PPT. Okay. Okay, so it's already seen. Okay, yeah. Yeah, as the moderator said that currently I am a director of undergraduate program of nursing, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. And this is the quote, yeah. Education is the ability to meet life situation. Man can learn nothing except by going from the known to the unknown. And the new normal for education requires us to unlearn what we have always known to establish the new normal of education. Yeah, the quotes, it's mean that we make we make progress. Yeah, when we make progress, we must try to get through the crisis. We must adapt, be able to adapt and move from the comfort zone. And we realized that we concerned about the second wave of outbreak. But however, creating the new normal must beyond of the pandemic and conquering the fear of the disease. And before we enter the new normal, of course, we should some preparation. First, reflect. Reflect of the pros and cons of one remote teaching experience. We know that since March, we did fully online teaching learning, and now the Ministry of Education gradually open the possibility for us to open our university. So we should reflect what they already did last semester, and then refine. After we reflect, we should have a positive part from previous learn, and then seek new methods. Actually, the WHO have criteria for easing lockdowns. Yeah, when we decide when we decide to the new norm, we should take a look the criteria of WHO. We can enter the new norm if the transmission of the disease is controlled, and we make sure that our health system capacity are good to detect, to test, to isolate and treat every COVID-19 case and trace every contact. And also we make sure that we can minimize outbreak risk in special setting. And we make sure that we have preventive measures are in place in workplaces, schools, and other places. Yeah. And also we make sure that importation risk can be managed, and as well as we make sure that our communities are fully educated, engaged, and empowered to adjust to the new norm. So this criteria we must reflect that is if we can fully the criteria developed by WHO, we can ease a lockdown. And also there are 4 aspects that should be pay attention to is the transition to the new normal. First, shift of learning space from public space to personal space. And the second, shift of teaching methods from one size fits all to individualized and differentiated learning. Yeah, as a teacher, we must innovative and creative to develop various learning strategies. Also, there is a shift of responsibility in teaching and learning process. The key is active participation, not teacher-centered, but the student-centered. Also, shift e-learning evaluation from final exam to formative assessment. It means that before we only rely to evaluate our student based on final exam, and put only little percentage in the formative assessment. So to the transition to the new normal, we should consider that formative assessment also important thing to evaluate beside a final exam. And how about new normal transition? I will share as a lesson learned from School of Nursing, UGM. And this is our university. This is the gate of our university. Universitas Gadjah Mada is the oldest public university in Indonesia. And also we have MOU also with NCKU. And this is our faculty. School of Nursing belongs of Faculty of Medicine, Public Health, and Nursing. And this is the building of Department of Nursing. And when we when we decide preparation to go to new norm, we pay attention the national policy. The national policy, the principle is the health and safety of students, educators, education personnel, family, and the community are the main priorities of learning policies. So the health and safety of students and educators is the first priority when we develop the strategies in the next semester. And UGM divide 3 phases respond to COVID-19. First, emergency response phase. The second is a recovery phase, and the third is new normal phase. So actually, new normal phase in UGM start on next year and 2022. Now we still prepare to the new normal pace. In emergency response phase last year, between March and July, in the second semester last academic year, the campus totally locked down. So the university closed the campus activity, and we did fully online teaching. And on July, we prepare for the next phase. And on July, there is a policy from UGM that especially for students in the end of the year of study, we can enter to the campus, but with strict protocol COVID. And the next semester, between August and January, the campus lockdown is. We plan to do blended learning, 50-50, and also we considering repopulation only 25%. And also we strengthen the digital learning and still implement protocol COVID. And the second semester, February to July, campus open, but still we implementation a new protocol and blended learning, 40 and 60, and considering repopulation 75% and still strengthening the digital learning. And the new normal pace we will develop on August to January 2022. Okay, we considering in the new normal pace, the campus open and all the students can enter the campus. And how about the new normal transition in our school? We follow the guideline from UGM. This kind of the surat rektor tentang pedoman KBM dalam masa pandemi COVID-19 dan menuju tatanan kenormalan baru di UGM. There are five components that we concern. First, policies, academic, internship, human resources, and facilities. For the policies, we follow the regulation from university and also the national policies. And in academic part, the next semester begins on August. Between August and October, we will we still do online class, online tutorial, and online seminar. Until October, we still fully online teaching learning. But start from November to January, we start to do offline, especially for skills laboratory and practicum. However, we make some adaptation to do skill laboratory and practicum. First, we reduce the number of students in a group. Before, one group consists of 12 students, but next we reduce the number of students 50%. And also reduce time interaction. One group only 1 hour, before one group 2 hours. And also the student must strict the protocol COVID, must obey the protocol of COVID. And before they enter to the campus, they must do a rapid test and then do self-quarantine for 14 days. Both of online and offline, we combine synchronous and asynchronous method. Yeah, this is we have also the Moodle. The Moodle, Elisa, we call Elisa. This is the Moodle of UGM. So for the asynchronous method, the teacher will put the PowerPoint, record the PPT, or link the video quiz or guideline, put in our Moodle, Elisa learning management system, put in here as an asynchronous method. And then for synchronous method, after that, the student can discuss with the teacher, online discussion through Zoom, WhatsApp group, Webex, or Microsoft Teams, etc. And in the internship phase, next semester, start from July, because last semester we didn't send our students to the hospital. So in the next semester, we start to send our students to the hospital. However, there are some requirements. First, we only send the student in the green zone. So before we send our student to the hospital, we how we conduct the meeting with the hospital to know the ward that is in a green zone. And also we limit the number of the student. One ward, maximum only 3 students. And also we reduce the hours of practice. Only 5 hours per day and only 3 to 4 days in a week. And also in the internship phase, we also combine synchronous and asynchronous method. So because they only stay in the hospital only 5 hours a day, so next hour they discuss with the teacher, with the preceptor, using combined synchronous and asynchronous. And also before the student enter the hospital, there are some requirement. For example, they must perform rapid test and also self-quarantine for 14 days. Yeah, currently all of our students stay at their hometown. So before they back to the Yogyakarta, They must perform rapid test and self-quarantine for 14 days, and then they can come to the hospital. And during the placement, during they stay in the hospital, their uniform can wear one day only one uniform, and wear PPE level 1 and 2. And we also
Excuse me,
support.
Mrs. Aryani, maybe
Yes.
3 minutes more.
Okay.
Thank you.
1 minute again. Yeah. To support our strategies, we also build a help desk team, and also build a training for staff, both the lecturer and staff. We plan to do online teaching strategies training, training about instructional design, etc. And also we provide guidebook for online teaching. And this is some facilities that we provide to support the new normal transition in our school. Facility for hand washing, and also we put protocol. And this is a drop zone that not everyone can enter to campus. And also this is we have signed to make sure that they keep a physical distancing before come to the library. Yeah, I think it's finished, and please visit our social media and YouTube, Instagram, email, and website. Thank you.
Thank you very much for Mrs. Haryani. Such a very good presentation, and we also have the idea that how the education system is changing massively during this COVID-19 pandemic. And I would like to remind you all, the attendees, if you have any questions, please write down your question on the Q&A box so that we can have it on the discussion and answer session. And the next presentation is about how we can deliver social community services during this pandemic, because we need to still interact with the community, especially for the educator or the students that still doing the community nursing practice, so that they have to interact with the community. And so that the next presenter will talk about mainly related to that. And our next presenter, the panelist, is Mr. Sugiharto, NSMN PhD. He is the faculty member of Universitas Muhammadiyah Pekajangan, Indonesia. He got the Bachelor in Nursing from Diponegoro University, Master in Nursing from Angeles University Foundation, Philippines, and the PhD in Nursing from Ncku. None other than Ncku. And then his research and study related to diabetes mellitus, evidence-based practice in nursing, and gerontological nursing care. So if you have any similar topic to discuss, you can contact him related to those topics. And he has already published at least 6 articles related to his study in respected journals, and he equipped himself with a bunch of training, especially on evidence-based practice by GVI, and then fellowship members of Scholars Academic and Scientific Society. And without any further ado, please welcome Mr. Sugiharto, please. Silakan Pak Sugiharto, boleh memulai untuk share screen-nya. Thank you.
Okay, thank you very much, Azam, for your introduction. Honorable the Dean and Dean of College of Medicine, National Ncku University, Taiwan. Honorable Director of Department of Nursing, faculty member, international student, and the alumni, and also all the participants. And I would like to say hello to my OSM advisor, Professor Yu Yun-Soo. Proud to be NCQ alumni. Okay. Today, my topic is about the family empowering in supporting chronic disease patients facing the new normal era. Okay. This is my outline, and as we know that COVID-19 is threatening the chronic disease patient, because some studies they state that comorbid the individual with comorbid they are more vulnerable to get the COVID-19. So according to the study that individual with hypertension, they have treated by the COVID-19 around 20 to 21.1%. And then diabetes patient, they are 9.7 to 10%. And then from the CVD, 8 to 8.4%, and from the chronic pulmonary disease is around 1.5 to 3%. And as we know that most of the chronic disease patient, they are in elderly. So another studies, they said that the COVID-19 fatality rate by age, the elder people is more affected by the COVID-19. Around 26.4% is the fatality rate among the elder people. So the condition with COVID-19, if individual who has pre-existing chronic condition, they are strongly correlated with disease severity, with the OR around 3.5, and being admitted to the intensive care unit is 3.36. So it's make the chronic disease patient, they worry and fear with this condition. How to face this condition? So we can, as an alternative, we can use this framework with the patient-centered medical home. And according to the this model, the patient-centered medical home, it's about the partnership. So we will invite the patient and their family to engage in this their care. With the patient-centered medical home, we ask the patient and their family to active participation in the decision making, and utilization of information technology to support optimal patient care, and then performance measurement, patient education, and enhanced communication. Active participation of patient and families in quality improvement at the practical level. So with this model, we ask the patient and their family more engaged in their own management to cope the new condition with this pandemic. So the key point of patient and family engagement, firstly, is the partnership among patient, family members, and healthcare provider at multiple levels. And then the form of partnership are including specific behaviors, organizational policies, and principles, patient and family members as essential members of the healthcare team, and improving their health, quality, and safety, and also the delivery of healthcare. So if we show this framework, we can apply the model from Green, Neff, and Mikol that the self and family management during this new normal, or sometimes we can use another term is new adaptation, so because we need to adapt some new condition. Okay, according to this framework, from the first, we need to assess the 4 dimensions. First is about the health status. In this health status, first we need to know the severity of condition. The higher severity, higher self-management needs, and then the regimen, higher complexity, higher self-management needs. So the trajectory is depend on the condition and the stage. For example, if because I'm concerned in diabetes, if the diabetic patient they have some comorbid or some complication, so it's more complicated for their self-care or self-management. And then the genetics. From the individual factors dimension, we need to assess about the age. The age here, the younger and older age, higher family management needs. So they need more help from their family. The gender, we know that women and male sometimes they several studies they state that women more efficacy, have the higher efficacy because they are more adherence with the self management. Sometimes for a male patient, they just ignore and just make a simple way to taking care of himself. And then the psychosocial characteristics. Maybe they have depression, self-efficacy, integration and diversity, and also culture here. And then for the family factors, the social economy status, the lowest status associated with poor self-management, and the structure of the family, like in Indonesia, maybe some of the participants comes from another country. So in Indonesia, we are paternal structure. So father or male, they have power in the family as the guardian. And then the function, the higher function, better self-management. And the last dimension is the environmental context. So like social networks, more support networks, better self-management. Like my experience among the diabetic patient, because in Indonesia we have a Prolanis program, Prolanis, maybe some of the audience not familiar with Prolanis. Prolanis is the program pelayanan penyakit kronis that provide the health services for two chronic condition is hypertension and type 2 diabetes. So the Prolanis members, we have the good network and also like a friendship. It's a peer group among them. So if they join this Prolanis program, they have more support and also the better self-management. And then the community, also the healthcare system. So this is the foundation of the self and family management. We need to assess this for a dimension. Then for the outcomes, we can assess also we have a 4 dimension as the health status, about the control, about the morbidity and mortality. If they have a better management, so they can control their disease, they can decrease or minimize the complication, also the morbidity and the mortality. And for the individual outcomes, of course, if they have their good management, they will improve their quality of life and also the adherence, because the self-management is not about the adherence to take the medicine, but how the patient and the family to manage their self for their care. Like the now what is the symptom, how to cope this when they the complaint and others. So it's about the management. And then the family outcomes about the function, it could increase when they apply the good management, and also the lifestyle and the environmental context for the access, utilization, and provider relationship. So this is one of the framework that we can apply during this new adaptation model. So maybe some researcher or some scholars, they have another framework also apply for this. Okay. So when we engage the family in the self-management, they have the key point for this management. So their role are promoting health and wellness, and then managing a chronic and complex condition, and assisting with transitions and ongoing care for a patient of all ages. So everybody agree with this role? Yeah, especially in Indonesia. If in Indonesia, as a family, if one of the family member they get sick, so it's our responsibilities to taking care, especially if the person is our parents. So we will spend our time to taking care of them and have the high responsibilities for that. According to this rule, what is the fact? In the fact that family member accompaniment of healthcare encounters about 20 to 60%. They accompany their family members to go to the healthcare center. And then a family member presence during visits has been shown to facilitate patient-physician communication and self-management behavior. And companions behaviors, including recording a physician instructions, facilitating doctor understanding by relaying information regarding a patient history of needs, asking a question, explaining a physician instruction, and supporting medical decision making. Also, a family companions has been associated with greater patient satisfaction with the counseling and care they receive from healthcare providers. So we can see here that family have important role to taking care of the chronic disease patient, especially with this new era, with the new adaptation. So we need to keep the chronic disease patient stay at home to stay safety for their health. So with this condition,
Excuse me, Mr. Sugiharto, so maybe 2 minutes more, thank you.
Okay, so with this condition, we can apply the health information technology that still have the social and physical distancing, increase patient and family engagement in the, self-management. Why? This is it's possible in Indonesia because according to the some study, they said that Indonesia around 100 million population they are using a smartphone, so it's more applicable for the Indonesian. It is a sample. We have a Halodoc. They serve for the consultation, deliver the medicine, also the medical checkup. Also, we have teman diabetes. They all I one of the member this teman diabetes. So they will give announcement for us to remain like to check the blood glucose, and if they have online class, they will announce what the topic and when the schedule. And also this is probably I saw this screenshot because and invited by stickers Mercu Bakti Jaya. They have community services atau pengabdian masyarakat through a Zoom. They invite a diabetic patient. We learn about the health eating pattern during this pandemic. So they more interactive because some of them illiterate. So the family accompanied during this seminar. And this is also one of the sample that I always give the consultation with the patient through the WhatsApp group, because we have a WhatsApp group for the diabetic patient. So according this situation, I think the technology we can use, but we need to consider about some condition like connectivity, because as we know that Indonesia is widely, and some remote area they have a limitation or lack of the internet connectivity, and then the literacy of the chronic disease patient. So we need to like I mentioned a while ago, that we need to invite the family members to join this information technology. And the cost for the internet load, and also unclear feedback interpretation, because we need to see who is our audience, our patient, because we have a different level of education. So we need to give the more applicable languages for them to more clear to deliver our message. and the utility. And I think this is my presentation. Thank you very much, and hope can give some inspiring idea for the audience how to give the community serve during this new era. 谢谢你. Thank you.
Oh, 谢谢. Thank you very much, Mr. Sugiarto, and it is very enlightening for today's webinar, because we also need to consider not only how to deliver those kind of intervention, but also what we need to achieve on this certain population or particular population that we are addressed to. And please kindly check the question and answer box for Mrs. Haryani and also Mr. Sugiarto, because there are some question in there that we will discuss on the question and answer session. And please, I will remind again once more, for any participant, any attendees that has any question, please go to the Q&A chat box so that you can ask any question there, even in Indonesian language. We will try to translate that into English during the question and answer session. And the next presenter, the next panelist that we will have here, I'm very happy and very proud to have him here because we're previously during our study in Ncku, I'm taking my master's degree and he taking his doctoral degree. We are working under the same supervisor. Our supervisor is Professor Chingmin Lause. Thank you very much for coming too. And he is very FND, SKPNS, MSc, PhD. Our next, he's the last one, but he's certainly not the least. So because he's currently a faculty member in Faculty of Nursing, Universitas Airlangga Indonesia, and he took the bachelor degree from Universitas Airlangga, master from Asia University, Taiwan, and absolutely the PhD degree he got it from Ncku, Taiwan, and he already did the postdoc at La Trobe University, Australia. So he's amazing one. He got so many achievements related to the publication, and he is really well known related to publication in respected international journal, which is indexed by Scopus and non-Scopus. For this Scopus one, at least 70-30 articles with HI index 7, and it is indexed by Scopus, and it is very proud to have him here. And his study mainly related to nursing resources and its development. So is the published book chapters that he have. And then his study also related to nursing education and resources, community health nursing, and also migrant health that currently published. And then with the number of training and achievement, he also delivered in many training and seminars related to publication and research in nursing, and become a consultant in Ministry of Health of Indonesia and USAID project, sorry. So without any further ado, please welcome Mr. Ferry Effendi, please.
Yeah, thank you, Mr. Azam. Yeah, Mr. Azam and I was in the same group meeting, yeah, under the advisor of Professor Chingmin Chen, yeah, and as always, he looks very gorgeous and awesome. And let me share my screen. Okay, Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. I'm delighted to joining this event, the first webinar of Association of International Ncku Nursing Alumni. And firstly, let me express my sincere gratitude to the president of Ncku, Professor Hui Jiansu, yeah. And then to Professor Yan Sen-san as the Dean of College of Medicine, and then Professor Ncku as the Director of Nursing. And I also want to take a moment to recognize and thanks to all of the professor there. Yeah, I see Professor Ching Min Chen, Professor Miao Fen Yen, Professor Yu Yun Su, yeah, and all of the professor there. Yeah, thank you for your supportive and also positive encouragement to support our career. And lastly, I would also thanks to the organizer, Mimi and her team for this excellent work. Thank you for the great effort and hard work to make this webinar happen. And wish you all the best this time and in the future. So as requested by the organizer, I would deliver the presentation with the topic how to be productive in research during a pandemic. And yeah, I wouldn't say I am a productive researcher, yeah, but yeah, I did some project on the last activities related to research and publication. So on this session, I just want to share my experience, and also I'm willing to learn from all of you. So aside as a lecturer, my team and I also we are developing the nurse labor market, yeah, an Android-based application, which is the application to help nurses, yeah, not only in national market but also global market to find a decent work. So everyone are welcome to download and have these apps, but yeah, unluckily, these apps still under review at Google Play Store. So we are hoping to see these apps coming soon and get published by this week. And I also agree with the closing statement said by Professor Yu Yun Su that this era is the era of hope, creativity, and also sharing. And yeah, so do this app also created during the pandemic itself. So excellencies, participants, ladies and gentlemen, for me, Taiwan and especially National Ncku University is my second home. So I did my master degree and also doctoral degree in Taiwan, and also I brought my family there. And yeah, I was very lucky to live, learn, stay, and also grow in beautiful, peaceful, dynamic, and supportive communities at Taiwan. So even I had graduated in 2017, but as institution, our institution, Airlangga University, and also National Ncku University already established some activities related to the education, research, and also community service. So I feel that as an alumni, we have ongoing support, yeah, till now, and yeah, that's once again thanks to National Ncku University. So this is the outline of my presentation. I will try my best to make it clear, short, and understandable. So since March 2020, the WHO declared that COVID-19 was a pandemic. The world has changed, and our life was affected by COVID-19 pandemic. So everything has changed. We have to wear a mask when we go outside, yeah, and then use hand sanitizer, establishing the social distancing, and then obey the health protocols. So practically, we were forced to stay at home, yeah, study from home, yeah, pray from home, and also work from home. And I believe for all of Indonesian Muslim, yeah, this is the first time or the first year, yeah, that we celebrated Idul Fitri from our home also. And then still related to Ibu Yani and Pak Sugi presentation, we are coming to the new era, what so-called new normal era. So what about doing research during the pandemic? Yeah, because as a faculty member and also a researcher, the pressure is there. It is obviously we have to be creative. We have to get out of the box. Yeah, and then yeah, we need to share with others, and so we are expected to conduct research remotely and efficiently. So before further talk, yeah, I would like to ask audience, yeah, with this question: how many of you doing this activity during the pandemic of COVID-19? Please choose A if you do some research, choose B if you do some publication, C if you have done some research and publication, and D if you do nothing. So it's just a polling, and please respond this polling to pollef.com/ferryfnd199. So let's see how many of us, yeah, doing, yeah, maybe research, publication, both side, yeah, and then do nothing, yeah. So I believe, yeah, 57%, yeah, doing some research, and then yeah, 19% do nothing, yeah, and then 12 and 11%, yeah, doing research, publication, and also publication, yeah. And yeah, I believe that most of them doing research are nurses, yeah. So this is the example, yeah, for what is our activity during the pandemic, and I hope we can maintain this productivity. So what is being productive for us? Yeah, I think the definition are various. Yeah, and to me, being productive is I can plan it. Yeah, I can execute it. Yeah, and then I can achieve it. Yeah, but maybe for some faculty member or researcher, they have their own definition. And for sure, for researcher, it could be measured. So there is a measurement to see or to look at the indicators of productivity. So for mostly for researcher, we will look at the number of research, yeah, the number of published document, intellectual property right, or yeah, any other activity related to research itself. So we are very lucky in Indonesia. We do have SINTA database, yeah, Science and Technology Index. I believe most of you as a faculty member, yeah, having a SINTA ID or SINTA profile. And in SINTA ID, actually, this is the indicators, yeah. It's kind of self measurement or self evaluation to measure the performance of researcher itself, institution, and the journals. So here, like what you see that this is the dashboard of SINTA, and here we can see the number of books that we have written, the number of intellectual property right, our networks, yeah, and then the number of document published in national repository, yeah, we do have RAMA document also, the number of document indexed by Google Scholar, yeah, the number of document indexed by Web of Science, Clarivate Analytic, yeah, this is the toughest one, yeah, I think, because yeah, mostly in Taiwan they use this requirement, yeah, this database indexation as a part of graduation requirement. And also, yeah, we SINTA also provide research databases, yeah, how many funding, yeah, or how many research activities that we got on every years, yeah, and also how many Scopus documented. So by seeing or looking at this database, I think most of us can evaluate ourselves that where is our position right now and what we can achieve in the future. And what I likely most in Sinta database is the leveling of national accredited journal. Yeah, so we do have leveling of Sinta 1, Sinta 2 to Sinta 6. So everyone can track down the published paper at national accredited journals. Sorry, this one is still in Bahasa Indonesia, but the features of Sinta actually comprehensive. Yeah, it tells us anything, yeah, about our performance. Yeah, and then yeah, you may try by yourself. Yeah, when you would like to create a Sinta, or yeah, I think you already had the Sinta profile. Yeah, and this is some tips from me, yeah, for being productive. First thing first is I always organize, yeah, and I always plan in advance what I'm gonna do, yeah, for this coming week or for this coming month. So practically, I just use Google Calendar, yeah, for this purpose, yeah. And then this is just to ensure, yeah, that I don't miss any important deadlines or any important meeting. So everything should be organized, and we should spend our time wisely. And the second tips is prioritize your work, yeah, especially for Puyani. Yeah, I believe she's very busy, yeah, as the director. So as a faculty member and with some additional assignment from our university, I think every one of us also struggle within three pillars, yeah, education, research, and community service. How to divide us and how to achieve the target in our daily life. And yeah, this is also very tough of us, yeah. And I believe each of you having some priority. And also for student, I believe you should be aware with the length of your study and what is your target for the daily activity. And then the third tips is don't go alone, yeah, because as we address from our president, from the dean, and also from Professor Ncku and Professor Ncku, yeah. This time is time for collaboration. So this time is time for cooperation, and please don't go alone, yeah, because yeah, this is a long way to go, yeah, and you should build your team, yeah, especially at the departmental level, yeah, or you can expand to faculty level or outside your university. So work with any colleges, yeah, or work with any student. So like on this picture, I always work with my colleges, yeah, on the same department, or we can also invite some reviewer, some expert outside from our faculty, but still on the same university. And also for those who having resources to hire students, yeah, you may work with undergraduate, graduate, and also doctoral degree students working on the certain project. And I believe this may boosting your productivity. And the most important one is find your mentor. Yeah, I would suggest that National Ncku University having abundant resources, yeah, having a good mentor, yeah, and then you may pick up anybody who would like to be your mentor and also suit with your expertise, yeah. And
Mr. Ferry, maybe
Yeah.
3 minutes.
Okay,
Thank
3
you.
minutes, yeah. And money is important, so please secure the funding, yeah. And also you need to create new habits. What I mean here, what you do every day is matters. So if you want to get published at high impact journal, so you must read the high impact journals. Yeah, that's the key, and you should be consistent on this. And also please take a break, yeah, and maintain work-life balance, yeah, because when I was in Taiwan, these two places was my favorite places, yeah. I went to 7-Eleven, I went to night market, yeah, just to rewarding myself, yeah. And what should we do to shift the strategy during the COVID-19 pandemic, especially when we are doing the research? So here I would like to focus on the secondary data and tertiary data, or any studies type related to the review, because I believe that for the primary data, we most of us avoid this way, yeah. But except for the online or contactless survey. So for the secondary data, mostly we divided into two: free and open data, and also subscription data. And for the free and open data, this is very huge, yeah, potential for us, because still underutilized, especially in the context of Indonesia. So like, let's say we do have a demographic health survey, we do have Indonesian family life survey, and we also have a global school-based student health survey. All are open, all are free, and this data are available there. So they waiting for us to grab it and analyze it. And for the subscription, yeah, we have to pay some charges, yeah, but I believe the charges are quite cheap for us, yeah. We can access Susenas, yeah, Riskesdas, and also Rivaskes. This is the brief introduction of demographic and health survey. So this survey not only done in Indonesia, but also more than 90 countries, yeah, over the world. And you are not only utilizing the DHS data, but you may also utilize HIV/AIDS indicator survey, yeah, malaria indicator survey, and also service professional assessment survey. So there are a lot, there are like big data, but this is really a secondary data. And the sample size between 3,000 and 100,000 household. Yeah, you can imagine if you got this data and you get published, yeah, you may choose one of high impact journals on the list, yeah. Okay, and what I like most from the secondary data is mostly, yeah, they are national level representative, so we can really make this point as the strength of our research. And the second one is about Indonesian Family Life Survey. Yeah, you may look at the data in details by this one, but this is very good longitudinal data, yeah, panel data comprised of 13 provinces of Indonesia. And another survey, yeah, like what I said before, is global school-based student health survey. Yeah, you may utilize this also, and there are a lot of data from various countries. And the last one is the review study. Yeah, this is actually the tertiary data. So you may conduct systematic review, policy review, scoping review, or literature review. And yeah, you can refer to this publication, yeah, because many types of review studies, around 14, yeah, and maybe you may want to focus to one of these. Yeah. So this is the references, and yeah, thank you very much. Stay safe, healthy, and productive. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Mr. Ferry Effendi. You may take a rest for a bit, drink some coffee or Coke or whatever, and be relaxed first, because we will come to the question and answer session. And to make it more easier for the panelists, so I will invite Mrs. Haryani first, and then go with followed by Mr. Sugiharto, and then the last is Mr. Ferry with those questions, because we have quite some questions here for Mrs. Haryani. So maybe you would like to address first. Please, can Mrs. Haryani pop into the screen, and then we'll hear so many questions for her. Sorry. Mrs. Haryani, would you like to answer the first question from Made Martini from Bali? Actually, it is quite difficult in the evaluation, especially the attitude one, how we can measure the attitude and skills during this kind of blended or online learning. How your university cope with that?
Yeah. Okay. Thank you, Mrs. Made.
Made.
Made. Yeah, thank you for the question. So, yeah, I think for opinion, not all learning outcome, or we can say CPL, yeah, not all learning outcome can be measured in one strategies. For example, for the skills laboratory, we want to make sure that student can perform. So we cannot. It is difficult to replace the competency the student can perform using online learning. So in UGM last semester, that's why we suspend all of the practicum skills laboratory. We suspend it because in our institution we believe that the competency to perform cannot be measured by online learning. So next semester, we plan the student can hands-on the skills laboratory. However, because the skill laboratory consists of the knowledge part and also and the practicum, the skills part. So for the knowledge part, we provide some videos, skills laboratory, and put in the our Moodle learning management system, and then we order the students to see the videos, and then we put a quiz related with the videos. So when they come to the when they come to the practicum part, I mean hands-on the skill to do the skills laboratory, they already have knowledge about the skills like that.
Ah, cool. And the next question is actually related to some other questions. It's about if the students refuse to do the clinical placement, or they have, or should there be a substitution for a task? And also, if someone is vulnerable for clinical practice, is there any policy related to that?
Okay. Yeah. Sorry. Maybe I missed to explain in our presentation. One of the requirements to do the hospital, we provide informed choice. We say informed choice. The informed choice consists of the student must obey the protocol, strict protocol, and the student will replace in the green zone, and not to go to the hospital is not coercion. So if in the informed choice also we mention about they must in the health condition. So if the student and because the informed choice also signed by the student as well as their parent. So if the parents do not agree and the student do not agree to come to the hospital, so they can suspend, and we will how to say reschedule the rotation But we explain the consequences. Maybe the student will lengthen their study time. So we provide informed choice and signed by the parents and also the students.
So there are options for to whom that are not willing to go for the clinical placement due to the COVID-19 pandemic. So still option for still doing that, and also if they want to postpone it, and if they want to go for the clinical practice, they need a PPE. And it related to the next question actually. Who provide those PPE? Like you mentioned before about the PPE 1 and 2, who will provide that, and who will pay for that? Is university also supporting on it, or they have to pay by themselves?
Yeah. Okay. Yeah. The PPE provided by UGM, by institution, by School of Nursing. We provide to students the PPE.
So it's quite easy for the students, and it's so nice to have that kind of support for the students, and especially because it's quite pricey to have that in this kind of time, and usually the seller will increase their price and to make some money in this kind of situations too. The next question come from Irna Muhammadiyah Pekajangan Pekalongan. She asking about if the hospital doesn't accept the student to do the clinical practice in the hospital, how but actually it might not happen in your university. But if you have any comment on that, or suggestion, if the hospital will not allow the student to do the clinical practice, what they can do?
Yeah, I think this is the difficult situation, because
sure.
Yeah, because in the clinical practicum, again, the student must hands-on treat the patient. But maybe you can modify. Last semester we also modify the clinical practicum. So we provide case simulation and then discuss online. And then do some, because in the clinical practicum there are some competency also, not only the student can hands-on how to do skills, etc., but also there is also the knowledge. So maybe you can try that, provide a case simulation and then discuss, but still the student must how to say, hands-on, how to do maybe catheter care, etc. Still yeah.
There is an idea about to do like how to say that, the VR ones with the interactive with VR, but it will, I don't know, for the current situation, especially in Indonesia, it might not very applicable for them, and also the utilization of the technology in there, it might not very helpful in there. But in the future, it might be a good way to do the hands-on with those AI and then also VR situation.
Yeah,
I do think that way. How about you?
Yeah, hopefully. Or maybe you can, because for undergraduate program is the general nurse. So maybe you can, how to say, choose, not hospital, but maybe you can choose like, how to say, not big hospital, but maybe small hospital that not treat a COVID patient. Maybe they can accept the students. Maybe.
But still following the social distancing procedure and regulation. That is the most important one. Maybe that's all the question. Any last sentence to close your session, maybe, Mrs. Haryani?
Thank you. Oh, okay. Okay. For we know that in our country we had some limitation. Yeah. We don't have high technology. So, but to not how to say, do not underestimate, do not despair. We can do it together. Together we can Yeah, we can. Yeah, we can together. Together we can. We can together. That's right.
Cool. So we need to be creative in these limited resources and be together to encounter those problems. Thank you very much, Mrs. Harani. We will go to Dr. Sugi. Please pop up on the screen so that we can see you all here. The questions for you is more like, what if Mr. Sugi, can you already pop on here?
From Angry Sahara.
Cool. So the question for you is about if people very afraid, as we know that, oh my God, I don't want to get a corona, I don't want to get COVID-19 while I go to the hospital or public center, a public health center. So what if people just afraid to go there, but they need a treatment or they need to do the follow-up checkup, something like that for their chronic disease? Can you please explain about it?
Thank you for this great question. According to my experience, when I go to some hospital with our collaboration hospital, they, like I mentioned in my PPT, they already have a collaboration with Hello Doctor application. So, for example, like the chronic disease patient, if they don't have any chief complaints, so like, for example, a diabetic patient, they are always have the metformin for 1 month. So hospital can order to the patient and send through the Hello Doctor. So patient just stay at home, and the medicine will delivered by the team. And also, if they have another complaint and need to taking care in their home, some hospital they already provide a home care team. So they will send the team to the home, at the patient's home. This maybe it's available in even though in Pekalongan we are a small city, but we already have this the approach to the patient. That's like this. Mm-hmm.
So even but some of the public health center might already also apply the social distancing one and the social distancing regulation to ensure any patient who come to the public health center or hospital that able to do the checkup with a safe environment. So I do think that maybe currently it's quite okay to go to the hospital right now, as Dr. Sugi suggests too. The next question is about in this kind of pandemic era, is there any obstacle that encountered in delivering community services, especially for chronic disease patients? Is there any obstacle, and how we can how you can address that?
Yes. Thank you for Angry's question. Yes, like my presentation, it's my experiences to conduct these community services. So, like I mentioned that most of the chronic disease, like my patient, a diabetic patient, mostly are elderly. So most of them they are illiterate with the internet, with these the application and others. So that's why I raised the topic family empowerment. So to cope this problem, we invite the family to accompany the patient if during their meeting, visiting to the center, like this. And for the yes, I show in my presentation when I invited by stickers Mercu Bakti Jaya to give like the education about the pola makan sehat ala Minang. So we invite the family members to accompany the diabetic patient, because again, some of them, they have the limitation in the high technology. But for the patient who are who has literacy with the internet, they can join by themselves in in the teman diabetes. So I answer the other question, because I show the other question about the teman diabetes. The teman diabetes application, I'm not the endorsement, but I joined this.
So you're not paid by teman diabetes.
Hopefully, after they hear my voice. Yes, I joined the teman diabetes. There are some healthcare providers, also the patient and the family. So all of us, we have same opportunity to raise the question, to give the suggestion like that. So it's more interactive for the members. Yes, thank you.
Actually, it's related to the next question, because who are involved in that teman diabetes, is that all nursing who can able to deliver kind of to answer the question that raised in that group, or any other profession that involved in there, or just everyone that have those information able to answer those questions? Mr. Sugi? Yeah. Ladies and gentlemen, maybe Mr. Sugi still facing.
They
okay.
invite nurses.
Please bear with us, Mr. Sugi. You have a kind of
speech like yes, hello.
Okay.
Yes.
Cool.
Sometimes they invite nurses also, the medical. Yes. Mm-hmm. You hear my voice?
Sure. We can hear you clearly, but still my face on pop on a screen, so please bear with us here. Yeah.
Matiin dulu kali.
Yeah. Yes. For the turn, sometimes they invite
do anyone also experience the same thing as me? Because the signaling might not that great in this moment.
Yeah.
Okay, we can go with Mr. Ferry first, and then wait for Mr. Sugi to join back in Zoom so that we can go for his question. But right now we will go with Mr. Ferry first. Is that okay, Mr. Ferry?
Yes, please go ahead.
Sure. Because there are so many questions related to your topic, and it is amazing to have this kind of involvement that are related to the secondary data, how we can retrieve those data. So many questions related to that. If we were gonna doing the research, doing the on-hand or face-to-face research, it might be a little bit difficult in this difficult time. So how we can have those secondary data, and what are the choices, please?
Yeah, thank you. So for the secondary data, yeah, I believe that most of us already familiar about this, yeah, as I mentioned on my presentation, maybe the SDKI, yeah, Survey Demografi Kesehatan Indonesia, or in English is a demographic health survey. Yeah, this is a multi-country survey, nationally representative, yeah, and the data is quite big, yeah, quite large, and it has 1,000 variables. So you may pick up which variable that suits with your interest. And for the data accessibility, this is very convenient for us. Yeah, so you may googling it with DHS or SDKI. And then you may refer to website. First, Indonesian website. They also provided free and open. So as long as you've been registered and granted by the BKKBN office, at this case, for Indonesian, you can get the data easily. And for the national level, you may go to dhsprogram.com, www.dhsprogram.com, and then you can request the data there. But I suggest you, before you request permission to get the data, you have to be familiar with what is DHS and what is your research question and what you're gonna do with the secondary data, because they would like to ask some detailed information regarding your research protocols. So it's quite make our life easier, because as long as you have the research protocol and then you enter the data on that website, you may wait for 2 days, or 48 hours to get the approval. And in my experience, they never rejected any research protocol or any request from us. But if there is some additional information that you need to entry on that website, they will ask for this. And another strength is they already done the institutional reviewer board permission, so they have the IRB document, so you don't need to do the ethical approval by yourself, but you can request the document to them. So that's for the data accessibility. And for its different data, like Indonesian Family Life Survey or Global School Student Based Health Survey, the data quite open, so you don't need to register like in DSS program. But for the GSHS, you just download it, and then as I remember, you just need to give a consent that the data only for the research or educational purpose, and also the publication. Yeah, that's Mr. Nazim. I think you still mute.
Sorry, I still mute myself. Thank you very much. Actually, there is also a question on how we can find the mentor, related to, as you mentioned before, that doing research, we need not only to organize, which is quite a work to do, but also the teamwork. How we can find the mentor or any team to guide us in this kind of situation.
Yeah. Okay. Finding a mentor is also challenging for us, because it's like you find your advisor, and it's gonna be a long relationship, and this should be matched with your heart, with your feeling, and with your passion. So I suggest that if you would like to find any mentors, you may look at his profile. Please examine his or her portfolio. At least what I do is I'm doing research on the Scopus database. So I look at the profile of its researcher at Scopus database, or if you have access to Web of Science Clarivate database, you can look at those database. So any database, mostly they provided a comprehensive performance of its researcher. This is just to make sure that they have the same expertise with us, and they have the same passion with us. So that's the important point, because as you have contacted them, and then you work with them. Yeah, this is very challenging, and also very demanding. And you have to be open on the first time. So what is your purpose, and what is the job division, and then what is the responsibility of its researcher or its authors, need to be explained in advance. So everything should be clear, and that's the way I find the mentor. And also you may also use PubLaunch, www.publilaunch.com or www.author8.com, or author8, or org or .com, I forget. So this kind of database really helpful for researchers from developing country, especially, to find the good one. So it's like finding your mate, like matchmaking event, like finding your spouse, maybe. So that's very critical. So please keep in mind that you have to be careful, and also you have to be patient, look at the profile, the portfolio, and then try to approach your potential mentor.
And actually, related to the mentor, for the academician, it's quite maybe like have those connection to people who are really working in the research that very closely. But for nurses who work in the hospital, if they want to have a mentor, will they also quite okay to go to that link, or do you have any other suggestion?
Okay. For practitioners or for the nurses, I think still I'm thinking on the same ways, but the easiest way is asking your colleges, like maybe from nurses from Erlangga University Hospital. Sometimes they ask me whether I have friends who are specialized in certain nursing field, and then I just told them that maybe you can contact A, B, C, D who living and also having the same interests, and they are working in Taiwan hospital. So like snowballing sampling, you may ask your colleges, but also when you have a specific interest, I mean you may have developed your own research interest, like Mr. Suki on diabetes mellitus. I think the easiest way is to look at your references, because mostly we just cite, we just quote from any researchers, and I believe that some of those cited scholars also working on the hospital setting. So that's the easiest way, the way we can find the mentor for the clinical setting.
And actually, Mr. Sugi also mentioned that he got those kind of access to the Teman Diabetes from the organization who were making that kind of application, so that joining in the organization or non-government organization may helpful for you to get involved.
Yeah, definitely.
In the nursing area that you are concerned with or that you are passionate with. And actually, before your closing statement, Mr. Ferry, there is another question related to if we want to do the online survey, how do you feel, or how do you think about that? And is it a good research in your opinion? Or but actually we know that so many research currently conducted by online, even the online, how to say, interview and also focus group discussion through the interview. How about your view related to that, Mr. Ferry?
Yeah, I think the online methods, for the data collection in research, this is not something new for us. I still remember that in 2013, I also did interview through Skype, yeah, from Taiwan to Japan, and that was my first experience utilizing technology for conducting some research. And I also read from the high impact journals, yeah, the Lancet, yeah, and then New England Medicine Journal, yeah, and yeah, any other journals, yeah, high impact journal. They also receiving and publish a lot of online data collection. So yeah, I think we just need to be familiar with these ways. Yeah, we just need to enhance our infrastructure. Yeah, because as you may aware that yeah, my connection is maybe quite stable. Yeah, Puyani, yeah, and others, but maybe yeah, we cannot make everyone assume everyone the same as us. Yeah. And this is also a challenge when we are delivering the educational material to our student, and also to reach out our participant and respondent. Yeah, the infrastructure become the challenge. Yeah, so I suggest that if you would like to do a primary data collection through online, yeah, just keep in mind that you should obey the protocol. Yeah, you should read a lot. Yeah, just read and read from the high impact journals, the way they collect the data. Yeah, because still the same. Yeah, we have to get the consent. Yeah, before the data collection, we have to pass the IRB approval. Yeah, and yeah, everything almost similar step with offline ways, but yeah, online it's kind of a fancy ways for us. Yeah, and it's really boosting our productivity to produce research. So
in another level.
Yes, yeah, this is the new normal. Yeah, this is actually a challenge for us to to be familiar with this. Yeah.
Yep. Thank you very much, Mr. Ferry. Maybe the closing statement for doing the research and publication during the pandemic.
Okay. The closing statement, I think, yeah, we need to respond during the COVID-19 pandemic, with innovation and creativity. So please don't give up, yeah, with this situation, with this crisis. Yeah, we have, I believe that we have ability, yeah, to innovate and also to be creative, and together we can face this crisis.
Thank you very much. So the next one, I would like to invite Mr. Sugiarto to be back in the session, because there's still one left question to be answered. Actually, we also live from YouTube right now, so that actually there are also questions from there. And the question, let me check. The question is, yep,
okay.
Sure.
Thank you.
Clear. The question is from Sumarden. He asking about because older people is more vulnerable, as we know that there are more of they are more vulnerable to COVID-19. And do you have any suggestion for older people during this COVID-19 pandemic?
Okay. Yes. Like I mentioned that from the community health centers, they can give the, especially for the Prolanis members, we for the green area, I think like Mr. Ferry, he stay in Surabaya is red area. So I think we need to postpone the Prolanis activities. But for the green area, maybe we can, with the new normal, we can, some in Pekalongan, some of the community health centers, they this month they try to again to give the serve for Prolanis, and they divide the members 2 times, usually once a month, now twice a month. So to minimize the members to come to the center. And also we, because home visit also countered by the Prolani. So if we need to home visit for the Prolani patient, we can do that. This is the alternative during this situation.
Okay, thank you very much. And maybe the last sentence to close your session, Mr. Sugiarto.
The last sentence, ICC.
What is that?
Innovation, creative, and collaboration.
Oh,
so we need
brilliant.
to collaborate with all health providers to give the best services for our patient.
Thank you very much for the closing statement. Actually, I would like to kind of like, how to say that, to resume all of those COVID-19 pandemic suggestion related to delivering education and then delivering social services and also the research and publication. Those three parts, we need to follow the social distancing regulation and also procedure that applied in our place, in our workplace, and the area that we're in. And for the education one, we need to be creative in the limited resources and be together with all of the resources that happen in there. And then the second one related to the delivering services for people, especially the community services. We need to utilize the technology and be keen to learn that, so that we can utilize that well to ensure the follow-up and also increase the adherence of the treatment, and then to deliver the system better for the patients. And for the research one, we need to organize well and then do the teamwork, be more prioritize the need that we need to prioritize. And last one, maybe we need to really write it. So we just not think about it, but we need to write it down on our paper and then just submit it. So maybe that close the panel session for this international webinar. Thank you again for Dr. Haryani, Dr. Ferry, and also Dr. Sugiarto for brilliant and fabulous talk today. And thank you for the question and answer. Thank you for the attendance here. I'm Azam David Saifullah, and please stay safe, and back to the host. Thank you.
Okay, thank you very much, Azam, for leading this.
Sure,
okay,
my pleasure.
Wait a minute. Thank you very much for Azam for leading this interactive and also interesting discussion panel, and also for our speaker today, Pak Ferry PhD, Ibu Haryani, and also Pak Sugiarto, for your sharing knowledge. And also it is very important for us, of course, to be productive in this pandemic situation, even in academic, research, and clinical setting. And actually, this is not only a special day for Aina to help this conference, but also it is special day for Ibu Haryani, I think, because today is her birthday. So I would like to say happy birthday to Ibu Haryani. Wish all the best for you.
Thank you, thank you.
And always healthy and always in Allah protection.
Amin. Thank you.
Happy birthday, Ibu Haryani. Okay, and for all participants, I remind you that the evaluation link already shared from committee.
Because one of our professor gonna make greetings for you.
Okay.
Oh yeah.
Yeah. And Yu Yun, yeah, Professor Xu. I would like to say the happy birthday to Haryani.
Oh,
thank you.
It is very special from Professor Xu Yun. Okay, thank you very much for the prayer from Professor Su Yuyun. I think all participants also giving the best prayer for Ibu Haryani today.
Thank you, Amin. We miss you all.
Okay, so for all participants, please fill the evaluation link they already shared from the committee. And this evaluation link will be accessed and open until 6 p.m. So don't forget to fill this evaluation link. And ladies and gentlemen, we have had productive and also inspiring time together around 3 hours. And we hope that this conference will give many benefits for you. And we also hope you found the presentation and discussion section for this conference are informative and also helpful for all of us. And now it's time for me to close this conference. I will close this conference and I left you with a pantun in Bahasa. So, bunga mawar wangi sekali, bunga melati, indah untuk dinikmati. Aina, semoga terus berkarya kembali, dan sampai ketemu di event berikutnya bersama kami. Okay, till we meet again, perhaps in the next conference or in the next event, may all you have a safe, productive, and also healthy condition. And thank you very much for all professor in College of Medicine, our professor in Nursing Department NCKU. Thank you very much for always support us. Thank you for all NCKU nursing alumni who have hard work to help this conference, and of course for all participants who join in this conference. Saya Wahyu Dewi Sulistiarini, mohon undur diri. Thank you and see you. Bye-bye to the next conference and next event. Bye-bye.
Bye. Bye.
Terima kasih.
Very much for your contribution. See ya.
Yeah.
See you.
Thank you, Annie. Dah ya, live ya. Live ya. Oh, belum.
Hampir semua kegiatan diharuskan menjadi online. Seminar atau pelatihan misalnya, yang sekarang menjadi webinar. Pasti banyak ide untuk melakukan webinar kan? Atau memang butuh untuk diri sendiri dan organisasi? Tapi nggak tahu caranya gimana. Atau nggak punya partner yang reliable. Nurstek hadir sebagai solusi untuk mengemas webinar atau pelatihan online, dari mulai hosting webinar hingga pembuatan e-certificate. Selain itu, kami juga menyediakan pelayanan media promosi, website building, registrasi event, dan tentu pembuatan serta distribusi e-certificate. Didukung oleh tim yang berpengalaman memfasilitasi lebih dari 200 webinar atau pelatihan. Kami mengundang Anda untuk berkolaborasi mewujudkan dunia dengan kemudahan ilmu tanpa batas. Nurstek for a better continuing professional education.
Bapak Ibu pembicara belum live ya? Kita foto bersama yuk. Belum foto bersama tadi.
Ya, aku udah ganti baju sebentar.
Ayo foto dulu, jangan live dulu. Pak Ferry, Bu Yani.
Siap.
Pak Sugi.
Siap, nah.
Pak Nenden, Mbak Devita masih ada ya? Mas Denny, yuk kita foto dulu yuk.
Ya, Yatno komputernya tidak punya kamera.
Nggak bisa.
Aku ganti baju. Nggak apa-apa ya?
Ini aja.
Bentar. Ini masih share screen dari sana. Enggak ya?
Tunggu ya, Yatno coba masuk lewat.
Yang di sana biar foto dulu aja, terus habis itu nanti Duut itu bisa gabung ke situ buat di screenshot dulu, terus baru nanti yang kita di sini bisa di screenshot terpisah, nanti bisa disatuin sama Pak Faisal mungkin.
Iya ya, edit gitu ya.
Yang sana biar foto dulu aja. Aku maksudnya pakai sweater dulu.
Kamu cepet banget juga. Ininya gantinya Azam.
Sweaternya Harry Potter, Sam.
Kenapa?
Sweaternya Harry Potter kayaknya.
Aku kan Hufflepuff.
Mbak Uut nggak ikut foto itu.
Biarin aja, Bu.
Dia bisa anu kok selfie.
Uut. Oh iya udah. Enggak.
Kayaknya nggak dinyalain deh. Bete deh. Oi, buruan, boy.
Kita, woi, kita.
Ayo, kita juga mau foto.
Kita juga yang online.
Yang online mau foto juga nih.
Itu Pak Sugi udah syukur tuh. Udah maskeran Pak Ugi.
Nah, pembicara semuanya sudah live ya?
Sepertinya masih ada di sini.
Bu Yani sama itu. Ada. Pak Ferry.
Ada ya, Pak Ferry dan Pak Gi.
Pak Gi ada. Pak Ferry sudah live kayaknya.
Ya, kita diabaikan.
Iya ini.
Foto-foto sendiri.
Gak apa-apa, mungkin aku bisa, mungkin teman-teman yang online di sini, maksudnya yang muncul di sini bisa di screenshot sama
teman-teman alumni. Terima kasih atas usaha dan effortnya. Pak IO, ini yang tersedia 152 partisipan siapa aja?
Mbak Mimi, kita yang online mau foto juga.
Udah pada
bisa di
live.
screenshot sekarang
Kita juga
dari
Yaudah,
Mas Faiza sama Mas
walaupun
Nandi.
Yatno nggak punya kameranya.
Tapi kok di tempatku cuman ada
Halo Pak Faiza.
layarnya Ncku ya?
Halo Ibu.
Ini lo masih ada 151. Ya udah kita live ya.
Ya, kenapa? Kenapa Pak? Pulsanya. Aduh.
Mana yang
Mas Aja masih cetar banget ya.
Awat ya.
Ini loh, sampai 2 hari kayak gini nih mukanya nih.
Nanti
Pakai mat apa itu namanya, Sam?
mungkin beberapa ada ini ya, ada alumni ya di sini ya. Bisa di on kan nggak sih kameranya?
Dari Mas Nandi sama Mas Faiza mungkin yang live-nya bisa di-cut dulu kali ya.
Ya.